The acid that we should discuss today is carbolic acid. We have discussed acetic acid, we have discussed benzoic acid. Acetic acid is a acid which you will require in general cases in where nutrition problem is there, blood circulatory disturbances are there. Benzoic acid you will need in all the gouty cases, uric acid deposit cases. And in both the acids we see, and in all the acids that we will see that there will be weakness, collapse, prostration. This is a general phenomena, and we all know that acids have this phenomena. And this is the reason I kept it for the end, because acids is not something that will be your first prescription unless the disease has progressed so much that the collapse or weakness is evident very clearly. So today we'll study carbolic acid, a remedy which is very similar to arsenic album and creosote because it has elements of both these remedies. Creosote is very less often prescribed. Arsenic is abused by many physicians. Arsenic, Nux vomica, pulsatilla, you give left, right, and center, but sometimes you fail in those cases, and that's where these other remedies, which are satellites of these remedies or similar looking remedies, these will work. Like I shared in the case of cuprum metallicum in the last sessions of metals. I failed in a case of ipecac and then I gave cuprum met. It was a bad case of cough. That's where it worked. Ipecac and cuprum met are like related remedies, and ipecac is a vegetable analog to cuprum met. Once you know this relationship, your job to prescribe remedies in quick succession with good results become easy. That is what is most important for a homeopath. You will have a lot of lectures by a lot of homeopaths when to give which remedy, what to do, how to do, but there are very few homeopaths who will tell you how and where you will shuffle the remedies, how and where you will see that the remedy relationships should be looked for and prescribed. And from my sessions you will get some hints of it, because this is the most essential component which is practically required, and I believe in practicality more than anything else that is philosophical in nature. So good to see our regulars Sugneshwari, Samiksha, and MI Homeopathy and other people. And we'll begin with today's session on carbolic acid. The first thing that is written is potencies are made with alcohol, an exception to the rule for preparing acids. So most of the acids are not prepared this way. Here it is prepared this way. So what you see further is something like belladonna and magnesium phosphorica, which is pains which come and go suddenly. Normally acids will have a pain which is going on lingering for a long time. It will not be something that is going to harm them as an immediate measure. There will be extrusive pains, there will be disturbance at night or something which is going deeper within the bones or deeper tissues, but the pains will not be sudden. This is one of the remedies that will have sudden pains which stay for a short time and go for suddenly also for in a very short time. Belladonna and Macphos are very similar. So in all the cases where you fail with belladonna and Macphos, this is the next remedy that you should think of. Profound prostration, collapse, surface pale, bath in cold sweat. Now you will see that many patients that come to you, they either are weakened by the disease, by the force of the disease, especially in corona that you saw. Camphora was prescribed left, right and center. You couldn't touch the patient, but if you would have touched, you would have found that there was lot of coldness. Now you have a chance to explore these things in clinic, and these are the clinching factors for you to prescribe. There is nothing like a good physical general and particular which will guide you to prescribe. You can rely on it. Mental symptoms will mostly be theoretical and philosophical. You will make up in your mind or understand from the patient, but physical generals and particulars will not lie. So that is going to be your prescriptive pointers, and that's what you see in carbolic acid. Profound sweat, collapse, which is very much similar to Veratrum album, and the other remedies that we see mentioned are Carboveg and Camphora. So all those cases where we have given these preliminary remedies but still the improvement is not seen, maybe 6 hours later, 12 hours later, after frequent repetition, you should employ the carbolic acid as a remedy and you will see the result. Next thing is that physical exertion, even much walking, brings on abscess in some part, but generally in the right ear. So you should know when patient presents to you with abscess, whether which part is affected. Is it on the bone? Think of calcarea picrata, think of arnica. Is it in the ears? Think of arnica again and then carbolic acid again. It is soft tissue, think of calcarea carb. So this is the way you will shuffle from one remedy to another or in your minds before prescribing, and you will have to refer different books where different things are mentioned and you will get a successful prescriptive pointer from the presentation of the case itself. It's very easy, you just need to understand from different sources and you will get across. So you have something in the ear happening like an abscess, and that is what is mentioned by R.T. Cooper, one of the very senior physicians of Clark and his time, and you can rely on this prescription. Putrid discharges from mouth, nose, throat, nostrils, rectum, vagina. You see that there is a putridity in the breath, in the discharges, lot of bad smell. You're called in to see a patient. The whole room is murkier and smelly, or the patient enters your cabin, the smell is there. When you examine the patient, the smell is there. These things may not be told by the patient, but if you observe and you give a closer look, you will find that these things will give you indications to carbolic acid. The other remedies being over here anthracinum, creosote, sorinum and phytolacca. Longing for whiskey and tobacco. Yesterday itself I had a case where the lady was taking tobacco since 5 years of her age, and now she is almost 38-40 and she is still on tobacco. So tobacco as a longing craving was taken into the prescription pointers as a remedy for a deeper state. So similarly you will see this mentioned in Asaram europeum, Carboveg and carbolic acid. Next you see is dull heavy frontal headache, and as if a rubber band was stretched tightly over the forehead from temple to temple. Now this is one of the very interesting things of getting to know the headache of patient, where it is happening, how it is happening, and that definition will lead you to different remedies, different prescriptions. Over here you see the other remedies mentioned are gelsemium, platina, sulfur and carbolic acid. You will see the same thing mentioned also in Kali bichromicum, but the pains are linear. Most of the times the patients will tell you that the pains are over here, over here. This is linear pain of Kali bichromicum, and what you will see is some patients will point that the pain is here or here or here, something like a pointed pinpoint. That is ignatia for you. So these things are minute things. Patients may not tell you directly, but your observation will clinch the remedy's favor and you will be able to prescribe. Vomiting of drunkards in carbolic acid in pregnancy, seasickness, and in cancer of dark olive green fluid. So you know that dark olive green color is of the bile. Some pathology of the gastrointestinal tract involving the biliary system, liver system, will like pyrogen, septicemia happening, should give you a thought for carbolic acid. Dysentery, fluid mucus, like scrapings of mucous membranes, great tenesmus. We see this in many patients of dysentery, diarrhea reporting in summer, the season which is going to affect many Indians right now when the rains are settling and the period before the winter comes where there is a lot of heat. If you get such cases, think of Merck or carbolic acid as the remedy. Immediately the patient would be settled and get better. You see the same presence in Cantharis also. Diarrhea, the stool is thin, involuntary black, and again intolerable odor is what you see. So what you see in many acids is collapse, weakness and debility, and in carbolic acid you will see that there is an added element of bad smell or discharges which are foul or bad smelling. Leucorrhea, again you see acrid green, fetid and it is very copious in nature. Lacerated wounds from blunt instruments, bones are bare and crushed, much sloughing of the parts. So you can think of this remedy as one of the remedies for some gangrene like conditions, or conditions where there is injury. After the injury, the parts have been eaten away and there is no recovery happening. Carbolic acid may set the tone right. The other remedy mentioned is calendula, which is one of the most frequently prescribed remedy as an external application, but you can give it internally also and you will get good results. And when burns tend to ulceration and ichorous discharge, you can think of this remedy as one of the top remedies for prescription. You can compare carbolic acid with arsenic creosote. I started my talk about these two remedies. So in one of the cases where I failed by giving arsenic album, I saw that the patient is not improving, the bad breath is coming out from the mouth, there is a lot of weakness. I immediately started with carbolic acid. In a simple case of diarrhea, I improved this patient on carbolic acid 200 few doses like every 1 hour. So that's the way you do homeopathy. You switch on to remedies when you don't know what the stage of the remedy is. You will have to learn the relationships, you will have to learn the different sources where different authors have mentioned and get to your remedy. Arsenic, creosote are the related remedies in burns, ulcers, unhealthy offensive discharges, and then you see the mention of gelsemium, merksol, and sulfur also present in Allen's keynotes. And you can see that it is antidoted. Carbolic acid is one of the frequently used poisons for suicides. So if you have a case, very rarely it will happen that homeopath would have such a case, but there are rural OPDs that will have these type of cases. That's where you can think of vinegar to be given to the patient. Of course, you go through the other protocols where poisonings have been mentioned. How do you deal with that? But Allen mentions that vinegar can be taken, which would either internally or externally nullify or reduce the impact of carbolic acid, which is taken for suicidal purpose. So all those cases where you feel elements of arsenic and creosote are there and you think that both these remedies are coming very strongly, foul breath, lot of weakness, lot of diarrhea is there, or you think that there is grave pathology where their parts are being eaten up, acid is one of the first group of remedies that you should think of. If you get across this case, give carbolic acid and you will get good success. So that's all from today's session. If it has helped you, let me know in the comments, and we'll have a one-to-one talk very soon. So good to see Dr. Gauri, Dr. Vipul, Dr. Shreya Tamhanpure, and our regular people. So you can all go through my previous lectures, previous sessions, and get to know from Alan's keynotes. There are a lot of prescriptive pointers that we think of. On YouTube we have a few people, I can't see their names, but good to see so many people interested and curious to know something that is basic, something that is important for prescription. And if you are going through different videos and staying with me in the live, I believe you will upgrade your practice, which is required for practical clinical homeopathy. So that's all from me, and we'll get in touch again with the next acid in discussion tomorrow.